Hello. Have you ever felt dizzy, had a slight headache, or felt numb your limbs after taking a shower at night? You think it's just a small thing, just tired after a long day? But what if I told you that a habit of taking a shower late at night, or taking a shower with water that is too cold, not having time to cool down your body temperature in silently, increase your risk of stroke just overnight? This is not an empty warning. Dr. James Walker, a neurologist and stroke specialist with more than 20 years of research at Stanford University, was really shocked to realize more than 40% of patients hospitalized for mild or severe stroke at night have one thing in common. They take a shower at the wrong time, the wrong way, or in conditions that are not suitable for their age. The problem here is not just the water temperature. It is the sudden change in body temperature, the sudden expansion and contraction of cerebral blood vessels, and increased blood pressure when bathing in unsafe conditions, especially in people over 60 years old, when blood vessels have gradually lost their elasticity. The ability to regulate body temperature and blood pressure is no longer as flexible as before. A 2022 survey published in the Journal of Stroke and Cerebrovascular Diseases showed that elderly people who take cold baths below 25 degrees Celsius after 8 p.m. have a 2.7 times higher risk of stroke than those who do not do this. This story is not just dry data. Let's look at the facts. Thomas, 67 years old, living in Colorado, is an active person with a healthy lifestyle. But one fall night, after a late walk, he decided to take a cold bath to clean his body and sleep better. Just 2 hours later, he had a mild stroke. His left arm started to go numb, and his speech was a little slurred. Luckily, his wife recognized the signs and took him to the hospital in time. But the neurologist on duty that day, which was me, had to tell Thomas directly, taking a bath so late and suddenly is no different from gambling with life. Why is bathing so dangerous? Because when your body goes from a warm state, blood vessels dilate to contact with cold water, especially in the head, neck, and feet. The blood vessels will suddenly constrict to retain heat. This reflex leads to a rapid increase in blood pressure, especially in people who already have risk factors such as atherosclerosis, diabetes, dyslipidemia, or have had a TIA. And do you know what's worse? Most people over 60 don't feel these physiological changes clearly until it's too late. A stroke doesn't always come with a violent signal. Sometimes it starts with a mild headache, a feeling of weakness in the limbs, or a more restless sleep than usual. In the next section, we'll explore common mistakes that seniors make every day that they may be unknowingly damaging their brain's blood vessels. Along the way, I'll share 3 important questions you should ask yourself before you step into the shower if you're over 60. Do you see yourself or a loved one in a similar situation? Don't worry. There's still time to tune up and protect your brain from preventable disasters. Mistakes when bathing that cause the risk of stroke to increase after age 60. Do you think that bathing is just a daily hygiene matter, unrelated to brain health? In fact, there are 5 common mistakes in bathing habits that the elderly often make, and they are silently increasing the risk of stroke. Mistaken 1. Bathing too late. After 9 p.m., many people have the habit of bathing after watching the evening news or after a night walk. However, according to research from the American Heart Association, bathing after 9 p.m., especially in cold weather, causes the sympathetic nervous system to overwork, increasing blood pressure and reducing blood circulation to the brain. Danger. Elderly people have slow circulation and poor body temperature regulation, so they are prone to strong vasoconstriction, leading to a sudden increase in blood pressure, a leading cause of stroke. Mistake 2. Taking a cold shower suddenly when the body is still hot. Have you just gardened, done light exercise, or stepped out of a warm space and immediately stepped into a cold shower? This creates a thermal shock to the body, causing the blood vessels to constrict rapidly. The heart has to work harder, and blood pressure to spike. In many cases, within 10 minutes of bathing, The patient has had a cerebral ischemic attack. Quoted from Dr. Hannah Moore, cold showers may be invigorating to younger adults, but in seniors over 60, they pose a real vascular risk, especially if taken suddenly or when the body is overheated. Mistake 3. Taking a shower when blood pressure is unstable. Many elderly people do not monitor their blood pressure before bathing. Meanwhile, people with high blood pressure, especially at night, are often unaware that their blood pressure may be fluctuating at dangerous levels. Bathing with high blood pressure increases the risk of cerebral hemorrhage. Bathing with low blood pressure can easily cause fainting and falls in the bathroom, one of the leading causes of traumatic brain injury in the elderly. Mistake 4. Washing your hair before warming up your body. Pouring water directly on your head, especially cold water, causes the central nervous system to be strongly stimulated, causing blood vessels in the brain to constrict rapidly, leading to dizziness, loss of balance, or even stroke. The body should be warmed up first by washing your hands and feet or soaking in warm water for a few minutes before washing your hair. Mistake 5. The bathroom is too cold, not heated first. A bathroom with a temperature below 18 degrees Celsius is an extremely dangerous environment for people over 60 years old. The sudden change in temperature from a warm bedroom to a cold bathroom causes a rapid vasoconstriction reaction, stimulating the cardiovascular system, and can lead to a stroke within minutes. According to a 2023 survey from the Mayo Clinic, among elderly patients who suffered nighttime strokes at home, over 35% had bathed in unheated bathrooms within an hour before symptoms appeared. So how do you know if you're bathing safely? Remember these 3 questions before you step into the shower. Do I feel dizzy, lightheaded, or tired? If so, hold off on bathing, as this could be a sign of unstable blood pressure. Is the bathroom warm enough? If you shiver when you step in, it's too cold for your older body. Can I start with my limbs first? Don't pour water over your head right away. Start by warming your feet, hands, and body, then wash your hair. In the next section, I'll share exactly when it's best for people over 60 to bathe, what the safe water temperature is, and simple ways to prepare to reduce the risk of stroke in the shower to near zero, as recommended by leading neurologists. Have you ever felt dizzy after washing your hair, or had a headache right after getting out of the shower? If so, don't miss the next section. What you are about to learn could save your life or the life of a loved one. How to bath properly after age 60, the time and temperature that helps reduce the risk of stroke. After learning about the serious mistakes that many people are still making every day when bathing, the question is, so how to bathe properly and safely, especially when you are over 60? The important thing to understand is, the problem is not in bathing, but in how, when, and in what conditions you do it. The safest time to bathe after age 60, according to the American Stroke Association, is from 9 o'clock a.m. to before 6 o'clock p.m. Ideally, it is from 10 o'clock a.m. to 3 o'clock p.m., when blood pressure and body temperature are at their most stable. Why shouldn't you take a bath at night? After p.m., blood pressure tends to fluctuate abnormally. Blood vessels easily contract due to a decrease in body temperature, and the brain is easily damaged if it experiences heat shock or sudden anemia. The risk of stroke, transient cerebral ischemia, or even fainting in the bathroom all increase. The ideal water temperature for people over 60 years old is from 37°C to 39°C98, 6F102 2F. This is extremely important, and many people ignore it. You can check it with a bath thermometer or simply by feeling. The water is slightly warm, not hot, not cold. Taking a cold bath is absolutely not recommended for the elderly, even in the summer, because the ability to adapt to temperature changes has decreased. Bathing in water that is too hot is also dangerous, as it can cause excessive vasodilation, causing low blood pressure, dizziness, or loss of balance. How to bathe safely, as recommended by leading neurologists. Includes 5 steps to prepare before and during bathing to help protect the brain and cardiovascular system. Step 1. Warm up your body before bathing. Sit down and relax for 3-5 minutes in a place protected from the wind, wearing a robe or warm towel. If your limbs are cold, use a gentle heating pad on your palms and feet first. Step 2. Check your blood pressure if you have a history of high blood pressure or heart disease. If your blood pressure is above 150/95 mmHg, do not bathe immediately. Rest for another 15-30 minutes, then measure again. If you feel dizzy, have a headache, or have a rapid heartbeat, delay bathing until you are more stable. Step 3. Start from the lower body. Pour water from your feet, then your hands, then your back and chest. Never pour water directly on your head from the beginning. Shampooing is always the last step, when your body has fully adapted to the water temperature. Step 4. Do not shower for too long. Ideal shower time, 7-10 minutes. Long showers cause blood vessels to dilate excessively, which can easily cause low blood pressure, dizziness, or disorientation after leaving the shower. Step 5. After showering, dry yourself immediately and keep warm. Dry your whole body, especially your legs and back. Get dressed immediately after leaving the shower. In cold weather, use a gentle heater or warm jacket for 15-20 minutes after showering. Pay special attention to people who have had a TIA transient ischemic attack. If you have ever experienced symptoms such as transient mouth drooping, temporary arm weakness, or slurred speech, which are early warning signs of a stroke, then safe bathing rules must be strictly followed. Quote from neurologist David Kim, Johns Hopkins Medicine. Elderly patients with prior TIA events are extremely vulnerable to stroke-inducing triggers, even something as seemingly harmless as a cold shower. In the next section, I will point out the warning signs of stroke immediately after bathing that the elderly often ignore, along with instructions for responding in the first 5 minutes if you or a loved one shows signs of a stroke in the shower. Have you ever felt so tired after bathing today, your head is spinning, and you don't want to talk? Maybe it's not just tiredness, but a survival warning that your body is sending out signals. Warning signs of stroke after showing, and the 5 golden minutes to act. Have you ever stepped out of the shower feeling a little wobbly dizzy, with a racing heart, slurred speech, or not remembering what you are going to do? Many people often think that it is because they are tired, have been in the shower for too long, or are forgetful because they are old. But in fact, these can be early warning signs of an impending stroke. A stroke does not always come suddenly. It can whisper a warning to you after each wrong shower. According to the National Stroke Association, 1 in 4 strokes in people over 60 years old occur after activities that involve sudden changes in body temperature, such as bathing, swimming, or going from a cold room to a hot one. These mild, fleeting signs after a shower are often overlooked, but are actually signals from the brain calling for help. 7 signs of stroke after a shower that the elderly need to be aware of. Sudden slurred speech, or difficulty finding words. For example, you want to say, "I need a glass of water," but say bowl. Water, water. Numbness or weakness on one side of the face, arm, or leg, especially if it only occurs on the left or right side of the body. Lightheadedness, loss of balance when getting out of the shower. Loss of vision in one or both eyes, blurred, dark, or foggy vision. Sudden, severe headache, unlike any previous headache. Mild confusion, not remembering where you are or what you are going to do. Unable to repeat a simple sentence or understand what others are saying. If you or a loved one has any of these signs right after taking a shower, Don't wait. From the time symptoms appear, you only have about 4.5 golden hours to be treated effectively with clot-busting drugs TPA. But the realistic time to act is within the first 5–15 minutes. Act within the first 5 minutes. Save the brain. Here are 5 emergency steps if you suspect a stroke after bathing. 1. Apply the FAST principle. Quickly check for signs of stroke. Face. Ask the person to smile. See if one side of the face is drooping. Arms. Ask them to raise both arms. Does one arm fall down? Speech. Ask them to say a simple sentence. Is there slurred speech or incorrect words? Time. If there are any of the above signs, call 911 immediately. 2. Do not let the person lie down in the bathroom. Move them to a dry, airy place, but do not force them to stand up if they lose balance, which can cause a fall. 3. Gently warm the neck and chest with a warm towel, but do not use hot water or a heating pad. Do not suddenly increase the temperature. Keep the body temperature stable. 4. Do not give anything to drink, including water or blood pressure medication. If they have a stroke, they may lose their swallowing reflex, causing them to choke or choke. 5. Record the time the symptoms started. This is important information when you get to the hospital, deciding whether or not to use clot-busting drugs. Real story from Boston Neurological Hospital. A 71-year-old woman, Caroline, was brought to the hospital after her son noticed her stuttering after taking a shower. Her son quickly applied the FAST principle, calling 911 within 6 minutes of the onset of symptoms. The result? She was injected with TPA within 55 minutes of the onset and recovered almost completely after 2 weeks. If her son had waited an hour to see what happened, she could have lost the ability to speak or become permanently paralyzed. Don't confuse post-shower fatigue with a mini-stroke TIA. Mild fatigue after bathing. The body is exhausted, but does not lose language, does not lose balance, and usually recovers after a few minutes of rest. Mini-stroke TIA. There are clear neurological symptoms, but they are fleeting. This is a warning sign that a major stroke will occur in the next few days or hours. About 1/3 of people with TIA will have a major stroke within 7 days, if not intervene promptly. In the final part, I will summarize the golden bathing principles to help people over 60 live healthy and no longer worry about stroke, including tips on adjusting their daily routine using safety equipment in the bathroom and pre- and post-bath habits that help protect the brain in the long term. Have you or a loved one ever felt weak, numb, or had difficulty speaking right after bathing? Don't skip the next part, because sometimes the actions you change in the next week can determine the next 10 years of health. 10 golden principles for bathing to help people over 60 prevent stroke. After more than 20 years of researching and treating thousands of stroke patients, I have realized a simple but important thing. The bathroom can be the most dangerous place in the house if you are over 60 and do not change some small habits. The good news is, just by adjusting the following 10 principles, you can reduce the risk of stroke related to bathing to almost zero. Principle 1. Never bathe right after a full meal or exercise. After a meal or exercise, blood will rush to the digestive system or muscles. If you bathe immediately, especially with cold water, blood flow to the brain can decrease sharply, causing dizziness, fainting, or mild stroke. Ideal. Wait at least 45 to 60 minutes after eating or exercising before bathing. Principle 2. Bathe during the day. Avoid bathing after 8 p.m. During the day, blood pressure and body temperature are more stable. The circulatory system works better. At night, especially when the body is tired or blood pressure fluctuates, bathing can easily cause physiological shock, especially for people with a history of cardiovascular disease. Principle 3. Always warm up lightly before bathing. Do some light movements, such as rotating the wrists, ankles, stretching the shoulders, to help stimulate blood circulation and avoid sudden vasoconstriction when exposed to water. Principle 4. Warm up the body before washing hair or pouring water on the back. Do not pour water directly on the head when the body is still cold. Start with the feet and hands, then wash the hair. Washing hair is always the last step. Principle 5. Keep the water temperature between 37 - 39 degrees Celsius. Water that is too cold causes cerebral vasoconstriction. Water that is too hot can easily cause a drop in blood pressure. Ideal temperature. Feels comfortably warm, not hot or cold. Principle 6. Always check your blood pressure if you are being treated for high blood pressure. If your blood pressure is higher than 150/95, or you feel tired or dizzy, postpone bathing. Bathing with unstable blood pressure is one of the leading causes of stroke or falls in the bathroom. Principle 7. Equip the bathroom with safety equipment. Non-slip mats, fixed handrails, shower chairs for the elderly, adequate lighting and gentle heating in cold weather. Just one slip due to losing balance after bathing can cause serious traumatic brain injury. Principle 8. Never lock the bathroom door. In case of a stroke, relatives need to be able to access quickly. If privacy is needed, simply close the door or use a door latch that can be opened from the outside. Principle 9. Do not bathe if you have a fever, cold, or unusual headache. A body in a state of inflammation or temperature imbalance will be more vulnerable to damage to the brain's blood vessels if exposed to water, especially cold water. Principle 10. After bathing, sit down and stay warm for 10 to 15 minutes. Dry your entire body, get dressed immediately, and sit down on a chair or bed, avoiding walking or moving around immediately after bathing. A glass of warm water after bathing also helps to improve circulation and reduce pressure on the brain as blood vessels. Summary: protecting the brain starts in the bathroom. Many people believe that to prevent stroke, you need to eat properly, exercise, and take medication regularly. That's true. But few people realize that every wrong bath can also be a silent blow to the brain. Stroke does not discriminate between rich and poor, gender, or education level. It only takes a moment when you lose your guard, and sometimes it is the moment you step into the bathroom when your body is not ready. Share this video with your friends and relatives over 60. If you are 60 or older, or care for parents or grandparents, this information can save your life or theirs. Bathing properly every day is part of a long-term healthy living strategy, preventing strokes and protecting memory, mobility, and independence in daily life. Thank you for watching the entire content. If you find it useful, leave a comment. I learned how to bathe safely after 60. And don't forget to follow to update other important health videos.